With the training for the NMC OSCE, there's naturally an emphasis on observing best clinical practice in the role, as outlined in the Royal Marsden Manual and the European Resuscitation Council guidelines. However, applicants need to be aware that there's a strong focus placed on communication skills, in particular how they interact with the patient, build rapport, and involve the patient in decision-making. Throughout your preparation, there will be a focus on developing these skills. In this video, we'll go through some hints and tips to provide clarity and reinforce your practice. Most importantly, continually explain your actions to the patient. This demonstrates that you're involving the patient in their care and also helps to make your reasoning and course of action clear.
Can I take a look at your allergy band?
Yeah, I think that's on there.
All right, so it says Mark Brown, 25th of 9, 1957. All right, so the name of the drug is not written, the drug that you're allergic to.
All right.
So I'll make sure that after I am done with my observations, I'll come back with a new allergy band, which indicates the name of the drug.
Okay.
Okay.
Involve the patient in any decision making and ensure that you have their consent before undertaking any actions.
So I'm here, Mark, to do a set of observations on you. So I'll be checking your temperature, blood pressure, respiratory rate, your heart rate, and your oxygen saturation levels in your blood.
Okay.
Is that okay?
Effective communication will help avoid any uncertainty. For example, by making it clear which pain scoring tool you're referring to.
So if you have to score it on a pain scale of 0 to 10, where 0 is the least and 10 is the worst pain, where would you score it?
4.
4. So
Yeah.
do you think you're okay now, or do you need any painkillers now?
I think I'll manage. I'm okay.
All right, okay.
Explaining your actions will also help ensure you're treating the patient with dignity and respect.
All right, so I ensure that all the doors and windows are closed and adequate privacy is given to the patient. All right, Annie, so I'm just exposing that little bit of your thigh to just have a look at the injection site. Is that all right?
During conversation with the patient, make sure you both listen and respond to what they say. By doing so, you will build a more effective rapport.
So Julie, I'm going to ask you a couple of questions. What sort of job are you doing?
Yes, I'm a carer for an elderly gentleman.
Okay, so were you working until recently?
Up until the end of last week, yes, but I've had to take some sick leave.
Engage in active listening. React and respond to patients. Use both verbal and non-verbal communication. Make eye contact often. If a patient asks for something that is outside the scope of your role as a newly registered nurse, do not feel obliged to provide this. Always say that you will need to check with someone who will know and that you will come back to the patient.
So do you have any concerns, Jack?
Just when am I going to be discharged?
Okay, well, I do not know that, but definitely I'm going to speak to your doctor and he will come and guide you on that and he will be able to tell you better.
Above all, keep in mind your role is that of a nurse at point of registration. Remember, in your practice you'll be performing at this level. All of these tips are relevant in your everyday practice as a newly registered nurse. However, there are also some tips about how to effectively communicate during the OSCE itself. Even when not addressing the patient directly, you should continue to talk out loud, explaining the key things you're doing. Try to give voice to your thought processes. In other words, speak your thought bubbles. This ensures the assessor understands what you're trying to do and your reason for doing it.
Now I can see that my trolley is clean, so I'm going to assemble all my articles on the bottom shelf. So first of all, the dressing pack. So the packet is intact and the expiry is valid till December 2019.
Talk through what you're doing as though you're teaching someone else to do it. Make statements with assertiveness and authority.
Before that, I'll be checking the capillary refill. So I place it at the heart level and squeeze it for 5 seconds. Release it, and I see that it has come back within 2 seconds, so that's good.
You need to demonstrate effective communication, whether you're dealing with an actor or a mannequin. In both cases, they represent a genuine patient. In the case of a mannequin, the assessor will respond to your questions as if they were the patient.
Hello, good morning.
Good morning.
My name is Stephen. I'm your nurse this morning. Can I know your full name, please?
John White.
Can I check your ID band?
Yes, please.
Yeah.
Don't be led by the appearance of the mannequin. Remember, they could represent a patient of a different gender or age, for example. One tip here is to confirm the age and gender of the patient out loud, which will help to reinforce the scenario details in your own mind.
Could you tell me your date of birth, please?
Yeah, it's the 30th of the 3rd, 1962.
All right, I see the date of birth is 30th of 3rd, 1962. It's 30th of 3rd, 1962.
You're allowed to ask for clarification about the parameters of the activity. For example, there are different styles of mannequin. A practical question about how a particular model of mannequin works would be acceptable. You cannot ask questions about how to perform your duties or ask for guidance on how to undertake them. Asking someone to repeat themselves is fine. For example, if you struggle to understand their accent.
Sorry, I didn't get what you said. Can you please repeat it for me?
If you realise you've made a mistake or forgotten something, make sure you say so before time runs out during that station.
I forgot to check if the patient has got any swallowing difficulties. So
Okay.
I'll be checking again before I administer. So Mark, do you have any swallowing difficulties?
No, I don't.
Okay.
It's common for candidates to get nervous before any examination. Focus on the task ahead and ignore any activity or background noise around you. Think about teaching someone else the key points and start rehearsing some of the questions. Remember, there is nothing new to you in these simulations. You are simply being asked to demonstrate what you already know.